right now, more importantly, ladies and gentlemen, we've got my friend and yours, soon to be, Patricia, breast cancer survivor. How are you doing, Patricia?
I am doing great.
It's
Got no complaints.
it's great to see you, and I'm so glad that you could do this here on our last broadcast of 2020. So it's kind of a special broadcast.
Well, I am so thankful that you're having me and, ready to just talk about my journey.
Well, thank you so much. And you've been so open, like many of our guests have been, about your whole journey through breast cancer. We're so blessed to have folks like you that are willing to talk about what you went through because it's a wonderful learning process for our viewers out there. So I really appreciate your time. So, Patricia, the way I like to start everybody is, how did all this start? When did you find out you had breast cancer and what led you to that diagnosis?
Okay, so for me, it was just a regular routine mammogram. I am a stickler about my health. And so it was just, a regular checkup and something looked a little suspicious. And in fact, it was in December of 2010. And we had a big trip planned for the holidays. And so I kind of told the doctor, asked if it was okay that we wait until after the trip before we dove in more. And he said yes. And so we went on our trip. And when we came back is when things started to ramp up. And the doctor said, we saw some spots on your mammogram and, it looks like it's cancer. And so we really need to get you in for a biopsy, a needle biopsy. And so that's sort of how the whole odyssey started.
So, how old were you when that happened, if you don't mind my asking?
Okay, so that would have been 2011. So I would have been, I was born in 63. So late 40s, like 40, 48, I think.
And had you been
Um,
getting like annual mammograms since the age of like 40 or so?
so actually, I didn't start getting regular mammograms until I was 42. And it's because I'm one of those late bloomers who didn't have my babies until late. And so I had my youngest child at the age of 40, and then I breastfed her for 14 months. And so after she was weaned, then I started the breast cancer. I'm sorry, the mammograms after that. So it was like when I was 42.
Gotcha. And do you have breast cancer in your family?
Actually, yes, I do. What is funny, so my maternal aunt, my mom's youngest sister, is a breast cancer survivor. And then my grandmother's sister died of breast cancer in I want to say, late 70s, 80s, early 80s. But other than that, we have not had any other breast cancer.
So were you at all on red alert whenever they found something interesting or different? Were you kind of panicked or anything because you knew that there was a family history?
You know what? I wasn't. And the other piece of the puzzle there was when my surgeon started asking me about my history. He also made a note that my grandfather died of prostate cancer, and made a note that it was glandular cancer, and so that even was more of a red flag. But prior to the whole breast cancer odyssey, I hadn't even thought about it or worried because my grandmother's sister who passed so long ago. And then my mom's youngest sister is, she had it in her 40s and she's in her 60s now. And, she was just managing with it. So it wasn't really a big deal and wasn't really on my radar screen.
Gotcha. Yeah, and I don't know if you had to do this, but I had genetic testing. Did you happen to do genetic testing?
I did not know. And it's probably because, so it was caught on a routine mammogram.
Right?
It was caught in the super earliest stages. So
Uh-huh.
I was stage 0. In fact, it wasn't even a tumor. It was just some cells.
Right.
And the breast cancer doctor had to put a pin in and then send me to surgery so they could even find where it was to
Right.
do the
Yeah.
lumpectomy on it. So it was a super earliest stage. So no, we didn't
Yeah.
even do any genetic testing
That's
after that.
cool. Yeah, I mean, I don't know if there's any requirements. I'm sure insurance wise, there's probably some kind of a requirement. I know with Dr.
Probably now.
Yeah, Dr. O'Shaughnessy down at Baylor, who does a lot of clinical trials and things like that. She's super about anybody who's diagnosed getting the genetic testing. So if you ever wanted to do that, certainly let me know, and I can hook you
Okay.
up with the folks down there at Baylor, and you could get that checked out. But it's really cool because
Okay.
like I was stage 1, and
Oh.
yeah, and just so everybody else knows, I met Patricia through Jennifer, who is an awesome volunteer at Breast
Yay.
Cancer Can
Mhm.
Stick It, and I like
Love
to
her.
purposefully not talk to our guests prior to the show so that we can just have our little natural conversation here. So a lot of the things I'm telling you won't know, and the things you tell me I don't know either. But I was diagnosed with stage 1, so I was very early, and they also clipped it, like what you're talking about, and
Mhm.
when I had my surgery. And she did have me do the genetic testing, and part of that they have you do, I think it's called like a genogram or something like that, but it's essentially a
Uh,
family tree where you notate each person, if they had cancer, what kind of cancer, and then for every person, if anybody's passed away, you put what they died from. And so you have this cool thing. And so we did all this research with it. Anyway, my point is, be very interesting to see in your family, since you have that prostate cancer history, the breast cancer history and whatnot. So certainly that would be pretty cool to know about. So we should talk after this about that if you're interested in doing any of that genetic testing. It'd be very interesting to know.
Absolutely. And I think it would be useful information for my children
Yeah.
also to have,
Heck,
for their
heck
medical
yeah.
history. Yes.
Absolutely, absolutely. So we'll get together about that afterwards. But so there you go. You have your surgery, and what kind of surgery was it? Like a lumpectomy type of thing? I mean, you said it was cancer cells. So what kind of surgery did you have?
Okay, so let me back up a little bit.
Sure, sure.
So I was sent for the biopsy, and so they put you on this table, and your breast is supposed to poke through the bottom, the hole. Did you do that?
No, I didn't. But I've heard
Okay.
of people doing it like that, and mine was
Okay.
nothing like that. But I've heard of that. Tell me more.
Okay. So I get to the center and they're putting me on the table, and I'm twisting every which way to get it down in there so they could do the biopsy, because I guess the needle for the biopsy comes from the bottom. You got to get enough of your breast tissue in there. But mine was so far up under my arm that I couldn't get under enough. So then that was a bust. And they said, okay, we're going to have to
No
actually.
pun intended.
Um,
I'm sorry.
exactly.
If I didn't do that, my parents would be upset with me. I have to throw puns in there, as you were. So that was
I
a
know.
bust.
Yeah, and so they said, okay, well, we're going to have to actually, it can't be a needle biopsy. It's got to be, surgery and all that. So, and they were hoping when I went in for the regular biopsy that they could get all of it, but it turns out they didn't. So then I had to go in again because, they look at it under a microscope or whatever to see, if there's more and if it's clear the margins and stuff. So then I had to go a second time just to make sure they got everything.
Wow.
Hmm.
That's so two separate surgeries. And how far apart were those surgeries?
So it was like as soon as they said, we want to make sure we clear the margins. So maybe 2 weeks. It was pretty fast. I mean, because the doctor and myself, we just wanted to get through it because I kept telling them, hey, I have young children, so I have to get this done so I can get back to my life. That just was my mantra. And I get up in the morning thinking that, go to bed thinking that. And so it was pretty fast. I'd say within 2 weeks.
Wow. So 2 quick surgeries to get that cancer
Hmm.
straight on out of you. And then what did they do after that? Did you have any further treatment at that point?
Yes, I did. So after the margins were cleared, they said, you have an 85% chance based on what we're seeing and, the fact that it wasn't a tumor yet, that it is never going to recur. But if you get radiation, then we can increase your odds to 97%. And I'm like, sign me up. I
Yeah,
will do the
absolutely.
radiation.
Yeah, no doubt, no doubt. Anything
Yes,
to reduce your risk of having to deal with this again, or at a worse, something worse where it's larger or whatever, further along, advanced.
exactly.
Yeah.
Because at that point I had 7 and 9 year old, so, or I'm sorry, 8 and 10 year olds. And so I'm just like, yeah, just kept thinking about them, and thinking about the fact that, how blessed and lucky I was anyway. But I thought, if there's anything that gives me a better chance of not recurring, I'm going to take that. So I'm like, yep, sign me up. I will do it. So I had to do 6.5 weeks of radiation.
And tell us
And
about that a little bit if you could, because a lot of people watching aren't super familiar with it, and I actually didn't have radiation, so I'm always really
oh,
interested. Yeah, I had
oh,
chemotherapy and the surgery before chemo, and so
got it.
that was my route. But a lot of people don't understand what it's like, and if they do like a mold of your chest, and you have that netting and all that. So explain to people a little
Ah.
bit about what that was like for you.
Okay, so you go in. I didn't have netting or anything like that, but you go into. The place that I went to was right next. It was I'm in Plano, so was a cancer center that was next to Medical Center of Plano. I think it's called Medical City now. And so you go in 5 times a week. So I went in Monday through Friday, same time every day, and I would go in and you get on this big machine, and then I'm sorry, you get on a table, and there's this big machine that can circle the table, and they would positioned it just so that it delivered the radiation right to, so mine was on the right side. So deliver it. And so when I first started, well, let me back up for a second. So my cancer surgeon said, "Oh, you're young, you're going to do great with this. It's going to be a piece of cake." So I'm thinking, okay, hey, it's going to be a piece of cake. So for the first 2 weeks or so, it was okay. But then week 3, end of week 2 is when it started to get inflamed. And then I started having pain. And I thought, maybe they didn't get all the cancer out. Like, why is this hurting so much? And
Was
so
it hurting on the surface or deep down or kind of both?
Uh, I'm going to say it was hurting both. Just every place that it was irradiated, and it started to be swollen so that it was bigger than the other side.
Yeah. Yeah.
Even though there was a chunk of it that was taken out,
Right, right.
but so it was all inflamed, and I'm like, wow, this really hurts. And so one of my dear friends was a radiation therapist, and she said, "Oh yeah, that's actually that is very typical. It's like having a really bad sunburn." And I'm like, "Oh," so I got some aloe vera, and I would just treat it with aloe vera. But it got to be pretty intense starting in about week 3, and it just, you can't say, "Can we pause?" You just have to keep going.
You're
So
like in it
every
for
day,
in it for the long
I
haul, got to finish it
I'm in
out.
it to win it.
Yeah,
Right.
exactly.
I'm not quitting. So
Did
I just slathered myself with aloe vera oil, the yeah,
Yeah.
the gel,
Yeah.
and just kind of took Tylenol and stuff and rested a whole bunch.
Did it actually look sunburned, and was it hot to the touch?
Yes.
And because I've seen
It
some
looks
crazy
sunburned.
pictures before where it's
Yes.
like really like almost crispy burnt, and
It looked like a terrible sunburn, yes.
oh
In fact,
gosh.
it's been almost 10 years,
Mhm.
because this was in January of 2011, right? So we're
Right.
almost to January again.
Yeah.
So it looked pretty burned, like it was a really bad sunburn. But all things considered, um, I would do it again in a
Yeah, I mean,
heartbeat.
and whatever it takes to save your life and take care of your health, and prevent breast cancer or reduce your risk, absolutely. I want to.
And it's in the rearview mirror now.
Yeah, exactly. It's behind you. And as I warned you, I want to be sure and give a shout out to some folks who are watching. Monte, thanks for being here. Claudia's here. Chad is here. Cherie is here. Jerry, David, thank you guys for joining us. And be sure if you have questions for Patricia, please pop them in the comments. And we do have one question from Claudia, and I guess we could compare our notes here, Patricia, because we're right at this point about radiation. And she was asking if the radiation symptoms are easier to handle than chemo. And I think, since you didn't have chemo and I didn't have radiation, we would just have to compare notes on that. But I know that they are very different symptoms, generally speaking. Like the majority of the people that I talked to have that burning, and there was a specific type of lotion that I've noticed in a lot of the Facebook groups that I'm in. It's like, forget the name. I was going to go try to look it up real quick. But it's a specific lotion or cream that they have like at the, Walgreens or a pharmacy that you can use. And a lot of the women who do radiation use that. So with radiation, you have a visible thing happening and the burning and everything like that. Whereas with chemo, you don't have anything like that because the chemo is more systemic. So it's going into your bloodstream and into you, whereas radiation is on the outside. And so I'm guessing with like radiation, you don't have the heartburn or the food tasting weird or nausea or bone aches and joint aches and things like that. So the symptoms with chemo and radiation are just very different. I don't know which would be worse to handle. I don't think either one of them sounds like too much fun to me, but they are definitely different, I would say. What other like things, kind of symptoms and things like that did you get from radiation? Was there other things other than that?
So it did make me, once the burn started, it did make me really, really fatigued. So I found myself sleeping a lot more and just laying down. And then, toward the end of it, it just felt like a real trial to lift my arm and on that side, and it was super tender. It just felt like a giant sore, that you're trying to protect. Trying to protect. And so I was an avid person that would work out, go to the gym and do the classes and stuff. And once the burn started and it started to be discolored, I didn't want to jostle it. So I stopped going to the gym for a while until after it was over and after a lot of healing had done. And it took probably a good year for it to go back down again because it got to be bigger than the other side. And it got to the point where the discoloration was starting to subside, but the swelling didn't go all the way down for about a full year.
Wow.
So I
that's
didn't
a long
do
time.
any reconstruction until after, because I didn't want anybody touching me, after that.
Right.
So I didn't do reconstruction until the next year.
So in the surgery, they took out your entire breast?
No, but when they did in fact, I have scar tissue now. So they took out enough that there's a dent over there. And
I see.
It made it sizably smaller than the other side.
See, that's so interesting. And it's just like, I know that you've done this too. You've probably talked to a lot of different breast cancer survivors, and everybody's story is legitimately very different. And never have I can recall, have I talked to somebody who had like a lumpectomy that had to do reconstruction. Now, maybe it was part of it, and maybe they just didn't call it that or something like that. But I never even really thought about that. But yeah, you've got, like you said, like a divot, and so you want to replace that.
And then my side is much smaller, so it's noticeable. Right?
Gotcha. Yeah, I gotcha. Mm-hmm. So what did they use? You may have said it, but I was so honed in on the fact that you had this reconstruction. Where did they get the what did they use to reconstruct?
So I actually ended up going to a surgeon in Houston to do it, even though there's lots of great surgeons here. But they used silicone.
Gotcha.
So I had to get silicone implants, and they tried to fix a lot of because the side where I had the lumpectomy and the breast cancer was smaller, so they put a larger implant on that side to even them out. And then they had mentioned, they were going to like do like maybe get some fat out of my butt, and because even after they did that, it was still smaller. And they said, well, we can transfer fat from your booty and put it up there. And I was like,
yeah, I'm
pretty much done with cutting.
Yeah,
so I can live with this.
Right, put your scissors down, dude. I'm done, man. I'm all done.
It's so true. I like it. It's good enough.
Yeah. So I know with women when they have reconstruction that they have to go back every so many years and have them redone. So are you in that position now where you have to go back every so many years and have the silicone replaced, or what happens? What's the long term?
They did caution me. Yeah, they did caution me, and they said, these last 7 to 14 years or so, and I carry the card around in my purse, just in case I guess I'm in an accident or something and I can't talk about it. But so I haven't been at the point yet. But the other thing that I think may hasten some people to have to get them replaced sooner is that then I'm having to go twice a year for mammograms, and they're squishing, and I'm like, and then you have to sign away this waiver that says if it bursts, we can't be held responsible.
Really?
Right? You have to sign the waiver first.
I bet everybody does that has reconstruction does have to do that, but no one's ever brought that up before. No, that's crazy. Yeah, you don't think about.
You know what I went through.
Yeah,
you would not be trying to burst these things. You would leave them alone.
Exactly. Stop that. I mean, and gosh, wow, that's interesting. I never really thought about that.
And that was 5 years worth. So I had 10 years worth of mammograms in 5 years, because they're checking to see. But every time I went, it was a clean bill of health.
Yeah, that's great. And do they ever, because I know like there's different reasoning for it, but they in certain scenarios they do mammograms, and other scenarios they do ultrasounds. Do they ever do ultrasounds, or is it just always mammograms across the board?
I always got both.
Gotcha.
Once I had that diagnosis, now every time I go, it's always both. So it starts with a mammogram, and then they follow up with an ultrasound. Yes.
Okay.
Just to make sure, they're always looking. And now I've been told, so now I'm 57, and I'm told that I have dense breast tissue.
Yeah.
So, like, what does that mean? Like if you're, but so they're looking, the ultrasound is just an extra look. And then I get the, pay for the extra imaging so you can see better, just so they can have a really good look every time. So and I recommend very strongly regular mammograms, people.
Yes, absolutely. No doubt. Found. Yeah, and that's the thing is mine was found in a routine exam as well. I was going for ultrasounds every 6 months because I had dense breasts and I had fibrocystic breasts. And so it makes it a lot more difficult to find breast cancer. What they didn't know back then was actually having fibrocystic breasts is a risk factor for breast cancer, but they didn't know it at that time. They were just using extra caution because it made it harder to find breast cancer. But now they realize that it's actually a risk factor. So that's interesting. I don't know about dense specifically, but it may be as well. But you should check out, I know we've got your list now, so we've got the genetic testing we're going to talk about, and then there's another organization called Are You Dense, and they talk about mandating isn't that cute? They talk about mandating that doctors have to tell you if you have dense and fibrocystic breasts so that you can make decisions about your breast health based on that. And so you might check that out too, just while we're throwing this stuff around. But wow, that is so interesting. So when do you expect to have another surgery?
Right now I'm unsure because so they always, when I have my mammograms, they look to see whether the implants are ruptured, and they've been fine. So I think I probably, if they say one of them is ruptured, is when I would go. Because I don't know any other way to check, So, they've been fine so far.
I don't, like I said, I can't stress enough that I don't know anything about this because I didn't have reconstruction. I had a double mastectomy with no reconstruction. And so I don't know anything about it, but I was under the impression anyways, and I'll have to check, we have this survivor group. I might just post in there and see, but I had thought that they were like, okay, at X amount of years, you need to come back in and do it. But I think that I feel sure that with you, yours is a different scenario because it's not a full breast reconstruction. So I bet it might be different from that. But I have to check on that because I was surprised actually. Like I said, I don't know anything about reconstruction because I didn't have it done. And so I was surprised when I
Right.
learned that you have to go back every so many years and have things, redone and replaced and whatnot. But that's interesting. Yeah.
Hmm.
Wow.
That's what they
Crazy.
said. Yeah.
Yeah. Yeah. So we got
And
your,
so I'm not at the end of the higher number. They said 7 to 14 years, and I'm not at the end of 14 yet.
gotcha.
So, but
Okay.
I imagine sometime around then.
Yep. Yep. That makes sense. That makes sense. I'm sorry.
Hmm.
I missed that when you said that 7 to 14 years. Got it.
Hmm.
Crazy. So we had your surgery, two surgeries, 2 weeks apart. You did your radiation, and now you're going for mammograms and ultrasounds, and they're smushing you all over the place. 10 ways to Tuesday.
Yes.
So, what else was a part of your journey through breast cancer? Were there any other like medications and things that you had to take post radiation? Are you on anything at this point?
No, I didn't have to take anything else. I
That's
guess because they
fantastic.
had caught it so early. Hmm.
Yeah,
Yes. Now, but I do wish that I had done genetic testing.
yeah.
So, but otherwise, no. I'm just going on with my life now. It feels like it was just a temporary blip, and I went over a speed bump and just kept on going. I'm trying to live my best life.
Yeah, exactly. No, and see, that's what's so cool about it is it's like, at the moment when you're in it, it feels like it's forever, right? But then when you look
Yes.
back, where you'll be almost 10 years coming up here, and I just celebrated my 10 years last month.
Yay.
So yeah, woohoo! So when you look back, it was just a little blip. Because you're looking through your whole life. I'm gonna be 52 next
Right.
year. So when you look through your whole life, and it's like this 1 year or months or however long it was for you, a year and a half or whatever it
Hmm.
was, it really is a blip. But it sure does change your way of thinking a lot when you go through something traumatic like that. So back when just to back up to the beginning, when they told you you had breast cancer, how did that hit you emotionally? I've been fixated on the whole process medically speaking, but how did that affect you emotionally at that time?
You know, I probably am weird, but I was just very pragmatic about it. So when the doctor, told me, yes, it is breast cancer, and we need to make a decision about what to do about it. I was just like, okay, well, let's get it done. I got a life to live here, and so boom, boom, boom. What are my options? So I wasn't like a basket case or anything like that. I was just about doing whatever needed to be done to get through it.
Yeah, you were just really, really focused, you know?
But I will tell you this, um, and I think I mentioned this to you before. The thing that was was the funniest to me and the most surprising was that when I would tell people, "Hey, I have breast cancer and I'm going to have to go through the treatment," then I would have to console them. So it was interesting, you
Yeah,
know.
it's weird. I think for whatever reason, I guess we just put on our strong battle gear. We're ready to go, and your friends are just thinking, this is the end of the road or something, and they're just
Right.
really panicked about it. And yeah, you're right. I remember having that same experience. It's interesting. Um, so you mentioned that your kids were young.
Hmm.
Did you tell them what was going on at the time, or did you
No, no.
no?
I didn't tell them. No, I didn't tell them until probably. I think we sat down and had the conversation after the reconstruction was done. So it would have been the next year. So they didn't. I didn't really tell them because I didn't want them to be afraid, and I just had this strong faith that I was going to be okay. So, but after it was all we were through it, then
Wow.
I
So
did tell them.
were they even scared even though it was over, or that kind of probably made them feel better knowing, hey, it's in the rearview mirror, like you
It's
said. Yeah.
exactly. They were
Yeah.
like, "Oh, really?" And the thing that I had to keep in my head when I talked to them and when I was talking to people and having to console them,
Right.
I would have to say, I would tell them and then I would follow up with, a breast cancer diagnosis doesn't have to be a death sentence. I just had to keep saying that, because I knew people who were 30-year survivors, and I thought if they could get breast cancer in the 70s and 80s and they're still alive and kicking, I got a pretty good chance. So I just was like, not a death sentence, doesn't have to be, right? For
Yeah.
some, it's pretty serious, but
Right.
not for everyone. So
You're
everybody's
right.
journey is different.
So different, and more
Hmm.
often than not, it's definitely not a death sentence anymore, thankfully, to
Hmm.
the major advances in technologies and things like that. It's just been really good, and early detection is one of the biggest reasons. So thankfully there's been pioneers before us that really pushed for that early detection that
Yeah.
essentially saved our lives. I like to think of it like that. I wanted to
Yeah.
mention, it looks like Tiffany has joined the party, and she said, "Forgive me if it was said, but how old was Patricia when the cancer was found? If she doesn't mind sharing." And I think you said you were in your late 40s, right?
Late 40s. Yeah. 47 or 48.
Yeah. Which actually they consider anything under 50 as young, which is interesting. So I remember I was diagnosed at 41. So that was
Oh.
interesting. Yeah. And
Hmm.
do you recall, like, with breast cancer, there's all these different hormones that could be affected. So there's the HER2 positive, the ER positive, PR positive. I was triple negative. Do you recall if they were able to relate that to your breast cancer at all, or was it just too early? I'm not sure how that would work with a stage 0. I'm sure that they would know if it was one of those
You know
hormones.
what? I never had any kind of testing like that to get an answer about it. So
Yeah.
I actually don't know.
Yeah.
In fact, I will tell you this. So since 1996, I have been in there's this national study called the Black Women's Health Study. And they modeled it after the nurses study where they're looking at women's health over a long period of time. And they asked me the exact same question. They said, did you have any genetic testing, or did they tell you it was sensitive to, one hormone or another? And I'm like, I have no idea. I don't know, because that was never tested. But I did send them a sample. I gave permission for the doctor or the office to send a sample of what they took out so they could have a look at it for themselves. So, but I don't know. So it would be interesting to see when I do because now you talk me into doing genetic
I'm so
testing.
glad. I'm so glad. I do feel that it's one of those things. I advocate for so many different things that relate
Mm,
to breast cancer, and this is one of those things that I advocate for. And that's really just my
mm-hmm.
doctor, who does the clinical research and trials, kind of speaking through
Ah,
me. She's just very interested in that. Anytime somebody is diagnosed, because it makes such a big difference in your prognosis, and also, if they find that you have certain genes, then your risk for other types of cancers can be a lot higher. So the BRCA1/2 mutation. If you had that, then you might want to do some preventative surgeries and things like that. So
right.
yeah, totally. And I know, like, a lot of people. A lot of times, I'll talk to women, and they don't know if they were HER2 positive, PR positive, ER positive, because it doesn't make a huge difference in their regimen. I think with triple negative, it's a big deal because it's rare and more aggressive, and so they kind of tell you that. But the other ones are not as fast growing as triple negative is. And so I've spoken to a lot of women who aren't familiar with which kind they had, and I actually have all the pathology. I was a total dork with my pathology. Like, I would just like look through everything, and
Oh.
went through a website before meeting with my doctor, and had all these questions that it told you to ask your doctor when you get diagnosed, and just like I was a
Mhm.
total dork, Patricia. Like, you and I could talk for eons on that. I mean, it's just like, I got so much information, and I recorded all my conversations with my doctor, and I still have those today. So it's pretty interesting. But yeah, I'll totally hook you up with the folks down there at Baylor about the genetic testing. Um, One of the things, Patricia, that I love to ask women that come on the show. Well, first of all, if I've missed any part of your journey, please throw it out there right now. I know we've covered basically your surgery and your treatment with your radiation, and basically how that hit you and your family. I just want to make sure if there's anything you wanted to be sure and let folks know about, that I gave you the opportunity for that.
Um, I think we've covered pretty much everything. The one thing I will say is that huh, it's just really good to ask lots of questions.
Yeah.
And so actually I need to revise one of the answers I gave you. You asked me about, how it hit me when I got the diagnosis. And I will say that I feel like I got a little bit stupider because normally I am the person that's like researching everything. And the one thing I did not do a lot of research on as I was going through was breast cancer treatments, options, and stuff like that. I just basically did what the doctor told me to do. And I will say now that if I had to do it again, I probably would have gotten a second opinion, and probably would have educated myself a little bit more about options rather than just doing whatever the doctor said. Not that I feel like I got bad treatment or because obviously I'm still here and I'm
Yeah,
still
totally.
healthy.
Yeah.
But I like to take more control of my own life and
And
my
your
own
health.
health. And
Mm.
yeah, and I feel like I did surrender it to the doctor um, more than I would now at
Right.
this point. So I always tell anyone, because people ask me now, I'm like, second opinion is your friend.
Yeah, yeah, it definitely doesn't hurt. And that's something that I say all the time too, is no one cares about your health more than you do. So it's really good to take charge and that kind of thing. And I did a lot
Mhm.
like you did as well. Now I asked a crap ton of questions, but I basically my doctor did give me all the options. Like my surgeon was like, you can do anything from this to all the way to here. And he said, and it's been shown if I did a lumpectomy, I could be just as good as if I did a mastectomy and all this stuff. He gave me the full
Oh,
realm, but I did some research and decided that what I wanted to do was be aggressive right back. So I did the most aggressive uh, surgery, the double mastectomy without reconstruction, and then they wanted to do the aggressive. I think it was a dose dense. Adriamycin, Cytoxin, and Taxol, which is very common among breast cancer patients. And so I did all of that. So I kind of went really aggressive, but I did ask a lot of questions. I didn't go for any second opinions that I could think of, except possibly when I was recovering from my surgery. I did meet with another oncologist briefly there, but I went with the one that I have. But
oh.
that's really good to good good advice. I think to ask a lot of questions, consider a second opinion, and more than anything, make sure that you have a team that you trust, and that you feel comfortable with, because definitely I've talked to women that are like, I don't like my guy, but I'm like, find someone else, man. You're gonna be in this for the long haul. You want, this
Hmm.
is somebody you're entrusting your life with, essentially. So yeah, that's really, really solid advice there. So one thing, Patricia, that I like to ask women who come on the show that are breast cancer survivors is if there is something that you want to share with folks that you feel that you gained, or a positive takeaway from going through breast cancer.
You know what? Yeah, it's made me appreciate the little things a lot more because I will say I can't speak for other people, but I, was just taking a lot of stuff for granted. And now I tell you just the littlest victories or just the everyday minutia of life, I love. I love it all, you know. And it's made me appreciate my life a lot more and to be thankful that I one had access to healthcare where I could go and have the routine mammograms. Two, that it was found early just through a routine mammogram. And three, that I had good treatment and good doctors where we could, do the treatment and I could continue with my life. So it's just made me appreciate life more
Amen.
and
Amen.
be fully present, just be fully
Yeah.
present in whatever I'm doing.
Yeah, and I think that those characteristics are super important in a 2020 type of year. You
Hmm.
know what I'm saying? And I think that I'm very grateful that I have that experience with me to help me through hard times like a year like 2020, to where I'm looking for the positive as opposed to staring at the negative, and just you know, really embracing the great things in life and being grateful, which is exactly what you're doing in life.
Okay, so get this.
Yeah,
So
hit me.
after I got through all the treatment and stuff and had the reconstruction, when I turned 50, I actually got certified and became a group fitness instructor.
That's awesome. How? Where do I sign up, dude?
So of course, because of COVID, I haven't been training, but I'm teaching at 24-hour fitness and
Uh-huh.
at a gym called Texas Family Fitness also. So I can't wait for
Wow.
this to be over so I can go back to work.
Yeah, you know, I've done a couple of virtual classes with Camp Gladiator
Oh yeah,
through
they're
this,
awesome.
and so doing the virtual classes with them has been great because, you know, you can
Hmm.
look like crap at home and turn off your camera if you want to and just do whatever.
Yes.
So it's been nice, but that's so cool. We'll have to keep in touch
Hmm.
on that as well. But let's touch base soon, and I'll hook you up with the folks down at Baylor for that genetic testing. I'll
Okay.
probably have Josie give you a call. We've got actually a person on our crew now who is an oncology nurse down at Baylor, and she helps guide
Oh,
people, and so she helps with guiding patients to different resources. So I'll definitely get her in touch with you and get you set up for that. And you'll have to come back and let us know how that goes, man. You know?
I will do
That'll
that.
be super cool. Well, thank you so much for taking time out of your day to join us today, Patricia, and talk about your journey through breast cancer. And for those who joined late, please watch the replay. Patricia was an awesome person to chat with, and we're going to have some
Oh,
more fun stuff here on the other side. But Patricia, thank you so much for joining us, and we'll stay in touch, okay?
sounds good.
All right, you take
Bye,
care.
everybody.
Take care, girl. All right, guys, that was Patricia, everybody. Give it up for her.